Hello, I'm Bayan, I'm a dietitian, and you may find this video helpful if you have been told by your kidney doctor, nurse or dietitian to reduce the potassium content in your diet. Today I'm here with Randa.
Hi Bayan.
Whose husband Jamal has been living with kidney disease. And they're originally from Egypt.
Yes, we are.
Right, tell me Randa, what are we going to do today?
Today we will making a Mediterranean salad.
A Mediterranean salad.
Yes.
So although this salad is from the Mediterranean cuisine, you may find the ideas of lowering the potassium content applicable to a lot of salads from all around the world. We will be showing you how to reduce the potassium content through food swaps and portion sizes. So today we will be making a kidney-friendly, lower potassium Mediterranean salad by choosing low potassium vegetables and choosing smaller portions of higher potassium vegetables. And now Randa, on to you. What are the ingredients we need for the salad?
We will need 4 medium tomato, 1 cucumber, 1 small red onion, 1 lime, 2 tablespoons dry mint leaves, half tablespoon salt and pepper, half tablespoon sumac and parsley.
So it is important to remember that tomatoes are a high potassium vegetable. There are some things we can do to reduce the potassium content without sacrificing the flavor. For example, we can limit the portion size to 3 to 4 cherry tomatoes or 3 to 4 slices of a full-size tomato. Or for example, we can use red peppers instead. 3 to 4 slices makes 1 portion. Cut up your tomatoes or peppers and add them to a bowl. Then add cucumber to your bowl. A portion of a cucumber is around 4 slices per person.
Add 1 small chopped red onion to the bowl. Add all the ingredients to a bowl. Season the salad with a little salt and black pepper. Add a little extra virgin olive oil and a little lemon juice for flavor. Toast the salad and enjoy.